All right, so at this point, I am in the med room. I'm going to be doing my Marchex for my artificial tears for Casey. He's had some dry eyes. So we're starting Marchex 1. I have Casey Banks, 10/2/1965, allergy to aspirin. Today we are giving artificial tears, 0.5%, and I have artificial tears, 0.5%. These are for the left eye, and I have sterile eye drops here. BID, dose of 3 drops. This is a brand new container, so I should have enough drops in here. Do it 0600. It was not given today at 0600. This expires 12/2024, and it does not contain aspirin. So Marchex 1 is complete for artificial tears. I'm going to start Marchex 2 right away. So we have Casey Banks, 10/2/1965, allergy to aspirin. We're giving artificial tears, and I have artificial tears, 0.5%, and I have 0.5% for the left eye, and I have sterile eye drops here for eye use only. BID, we're giving 3 drops. I have enough here to give 3 drops. Do it 0600, and it was not given for the 0600 due time today. So I'm going to take my medication, my MAR, a washcloth, and then 2 tissues into the room with me. So we're outside the room. We're going to go inside. So knock, knock. Hi, Casey. My name is Sarah. I'm the nurse taking care of you today. Can you state your name and date of birth for me, please? And we have Casey Banks. Casey Banks. And when's your birthday? 10/2/1965. 10/2/1965. Do you have any allergies, Casey? Casey says he's allergic to aspirin, and I do see an aspirin allergy on the wristband and on the MAR. Okay, Casey, so the reason why I am here, I know earlier you told me you were having a dry eye, is that correct? And Casey says, yeah, I'm still having a dry eye. All right, so I brought a medication called artificial tears with me. Have you ever had that before? And Casey says, nope, this is the first time. All right, Casey, so this is going to act as a lubricant in your eye. I'll place it very carefully, but it's gonna help lubricate and relieve some of that dryness, okay? And Casey says, sounds good. So I'm going to grab my gloves here. And before I do my assessments, I'm just going to get my Marchex out of the way. That way I do not forget about it. So this is going to be Marchex 3 in the patient's room. So we have Casey Banks, 10/2/1965, allergy to aspirin. We're giving artificial tears, and I have artificial tears here, 0.5%. 0.5%. For the left eye, these are sterile eye drops for eye use only. BID, 3 drops. I have enough to give 3 drops. At 0600, it was not given at that due time, and again, this does not contain aspirin in it. So I'm just going to roll these right away to get them to room temperature. Okay, I'm just going to set these here for now. So Marchex 3 is done. I'm going to do hand hygiene. I'm going to get my gloves on. Casey, I'm just going to take a look at your left eye. I'm verifying that I am on the patient's left side here, and I have my left eye. So I'm just going to feel around, do some palpating here. Any tenderness if I press there? No, I don't see any drainage, no erythema, no tenderness. There's no crusting. I am just going to clean your eye before we do these medications. So I'm cleaning from the inner canthus, so the corner closest to the nose, outward, with a warm washcloth here. I'm going to do that just a couple times. In to out, and then in to out, using a new part of the washcloth each time. This would go over to laundry. I have 1 tissue ready to block Casey's tears, if there are any from there, and he is laying flat, so that's good to go. I'm going to twist off the cap here, so I'm doing that horizontally. I don't want to cross over the tip of the eye drop cartridge or the inner part of the lid. So I'm setting my lid down on a tissue just like that. And again, we're doing 3 drops in the left eye. I'm going to bring my table just a little closer here. So Casey, I'm just putting my dominant hand on your forehead here. You're going to feel me bring my left hand onto your cheek, and I'm going to pull your eyelid down a little bit. I'm going to insert the drops in the conjunctival sac. I'm about 2 to 3 centimeters above there. So I'm going to do 1 drop, okay, and close your eyes, roll it around. I'm going to blot if there was any tears at all, which there's not, okay, and Here's the second drop. Okay, another drop. We're gonna apply pressure there. Okay, and then the last drop here. So that's 3 drops. I'm gonna hold pressure here for a little bit. This is just to prevent systemic effects. So now that we've done your eye drops, Casey, I just ask that you avoid rubbing your eye. You should feel some relief within the next few minutes from that lubricant in the eye drop, but I'll be checking back when we round in an hour just to make sure that everything is going okay. Okay, and just keep rolling your eye around. Good. All right, so our eye drops are administered. This is going to go in the garbage. I'm going to remove my gloves. That will also go in the garbage, and I'm going to recap my eye drop solution here. So without crossing over, keeping the tip sterile. And then I'm going to document that we did this medication. So it's 0600 SB. Okay. So make sure you have your call light, bed is in the lowest position, and the side rails are up. And like I said, I will be back in about an hour. And then I'll also document the appearance of the eye, if there was any redness, drainage, pain, oozing, and all that.